Hi, in this video I'd like to answer a very common question that we get regarding Hyperemesis Gravidarum. Now, a lot of women are asking us why some women don't get this condition, while some people get one of the most severe reactions from hyperemesis. The core reason behind this is because of an individual difference in the composition of your nervous systems. Now, you have abnormal receptors in your body, but this occurrence rate is very low. Only 1 to 2% of pregnant women have this type of receptors. And why exactly do they have these receptors, we are also unsure. But looking at our case studies, our patient histories, when we look at our patients, very likely that their mothers, their grandmothers, their aunties, godmothers, anyone with blood relation in their family who are women, most of them had the same reaction as well of having hyperemesis. So there is a clear genetic component. It's being inherited and passed down from generation to generation. So only 1 to 2% have this. So what exactly do they have? Well, let's look at the drawing here on the board. So I've drawn these, what we discussed is these HCG receptors, these chemoreceptors. Now all people have these receptors, but those who develop hyperemesis have abnormal chemoreceptors. Why do I call them abnormal? It's because they bind with HCG. Now normally we look at this white one, this is what's present in everybody's body, but people who have hyperemesis have this pink one. Although there are few, but they have this abnormal property of binding with this HCG. Normally when they don't bind, but during pregnancy, because of the presence of HCG in your blood due to the pregnancy, they are binding with these receptors. So all these molecules that are present start to bind with these receptors. And then depending on how many receptors you have and where they are present, you get different sorts of variations of hyperemesis, from the less severe types to the very severe reactions, so severe that they cause potential maternal death. So you can consider this that HCG is actually the cause of hyperemesis, but it's actually the secondary cause. The primary cause is actually these abnormal chemoreceptors, these M1 receptors that are not supposed to bind with HCG, but they are binding. Now, these M1 receptors are present almost systemically in your body, in your medulla oblongata, in your effector glands, your lungs, smooth muscles in your intestines, stomach. They are ever present, which is why these symptoms are associated with where they are found. For example, we see salivation very common amongst these women because there's a lot of M1 receptors that are binding with this HCG in your salivary glands. So this is what happens. So our treatment here is that before pregnancy, even though you still have these M1 receptors, our treatment, our HCG desensitizer actually blocks these M1 receptors. No, they won't affect your any organ functions, not to worry, but they can 100% prevent these HCG molecules from binding during pregnancy, which is why we always tell our patients to come before pregnancy. Because if you come during pregnancy, there's already binding that's already occurred, although we can substantially lower your symptom severity, but to ensure 100% no occurrence of hyperemesis, you have to come before pregnancy. So our HCG desensitizer is so effective that only 1 to 2 intravenous injections can already reduce your symptoms significantly. Your appetite is restored, your sleep is restored, all because of what's happening here that I explained, the blocking of these abnormal receptors. Now we offer a full refund guarantee to patients that come. Now if you still experience hyperemesis that leads to a miscarriage, then we offer you a full refund guarantee. Get in touch with us today and leave me a comment down below.